Dr. S has prescribed a panoramic x-ray for you today. Do you know what that is?
I do.
Perfect. Are you okay to go ahead and do that today?
Yeah, that's perfectly fine.
Great. So before we get started, I'm going to have you remove your glasses and anything metal, which includes your earrings. You place them in a Dixie cup.
Okay.
I'm going to go set up the panoramic room and I'll be right back.
That sounds good.
Before the dental hygienist takes her patient into the room, she needs to set up Capture Link on the computer. The first step is to select Capture Link. You can find it on the desktop. Once Capture Link is open, select Patient. Step 3. Under the Patient column, select Open Patient. Step 4. Under Open Patient, it will prompt you to type in the name, and for this purpose, we will be using Test. In Clinic, you will have to write down your client's name. Once you have selected Test or Client Name, select Capture. Step 6. Under the Caption column, select Twain device. Once in the Twain device window, select Auto Accept. Make sure that you do this first. Still under the Twain device window, select Acquire. Step 9. Next, a blue column will pop up. Make sure that you select Capture Op. Now a green screen will pop up stating that you're ready for your X-ray exposure. And remember, once it states ready for exposure, you need to hold down the exposure button for the entire exposure. These are not like the ones in RadLab where you can just press it for 2 seconds and the exposure is complete. To prep the room for the panoramic, the dental hygienist must put on gloves, a mask, and disinfect with a CaviWipe. After the dental hygienist has put on her gloves and mask, she must go into the room and completely disinfect all areas that could possibly become contaminated. After disinfecting the room, the dental hygienist can remove her gloves and mask before placing the barriers. 5 barriers need to be placed by the dental hygienist. 1 on the control panel, 2 on the patient ready panel, and 1 on each of the handles. The last barrier to place is on the exposure button. After placing the barriers, the dental hygienist must press patient ready prior to the patient entering the room. Make sure that the head support is as far forward as possible and that the temple supports are as wide open as possible. Before getting the patient, make sure that all of your settings are correct. You can use the arrows and the OK button to adjust the settings. In this case, we're going to be using the adult setting, which is setting number 2.
Alright, Diana, the panoramic room is all ready.
Before the dental hygienist takes the exposure, she must place the bite block barrier on in front of the client. Next, the dental hygienist must place the double-sided lead apron on the client. Notice there is no thyroid collar. Use the up and down buttons on the panel to adjust the height to suit the client. Guide your client to the unit and instruct them to grip the handles. Have your client stand straight up and tall. Have your client place their chin on the chin rest. Next, have them bite down in the groove of the bite block with their anterior teeth end to end. Ensure the patient's head is parallel to the floor. Have the client move their forehead up to the head support and close the temple support using the black knob. Position the lights on the client's face using the light button and watching through the mirror. Line up the face with the mid-sagittal plane. The light should pass through the tragus and infraorbital notch. Ask the client to smile, and based on the position of the canine, choose the layer. It will either be right on the canine, behind, or in front of the canine. Instruct the client to close their lips, swallow, and raise their tongue to the roof of their mouth until the exposure is complete. Have the client wiggle their feet up to the designated line. You can use your own foot as a guide. Instruct the client to stay still for the entire exposure. Confirm that the pan machine is in the exposure-ready position. Take the image standing at least 9 feet away. The image will gradually appear on the monitor during the exposure. Release the exposure button once the image has disappeared from the monitor.